But let's go to Agogo now, where the Presbyterian Hospital in Agogo has unveiled a newly furbished computerized tomography scan facility, together with a wellness clinic in efforts to meet the highest healthcare standards. Patients in and around the Asante-Achim Agogo requiring advanced diagnostics for their conditions have been compelled to travel to Kumasi and Accra. They're excited about being spared the long-distance drive and risk of accessing advanced diagnostic services. Clinton Yabua has more in the following report.
Hospital Agogo is on the path of becoming a tertiary health service provider. The 93-year-old facility usually uses typical clinical diagnostics in patients' treatment, which is not favorable in an era of evidence-based medicine. To address this situation, the Presbyterian Hospital Agogo has unveiled a new self-funded computerized tomography scan unit. The CT scan is a type of imaging that uses X-ray techniques to create detailed images of the body to plan medical, surgical, or radiation treatment. Radiologist at Presbyterian Hospital Agogo, Francis Collins Bimpong, says doctors can now refer delicate medical conditions requiring scans, which will aid patient monitoring.
Previously, patients had to travel long distances from Agogo to Kumasi to have these CT scans done. Now, people within our catchment areas in Agogo, in Konongo, in Fominkoko, even towards Ejuso can now come to access such important facility. When a doctor suspects that the patient has a particular condition, they can refer such patients to have a CT scan. Then we could now pinpoint and tell them what the true pathology is. This will help in the patient monitoring and then also management of the patient. Also, in addition, also with the follow-up of patients' conditions.
Additionally, the hospital opened its first wellness clinic to provide accessible services including comprehensive health screening, lifestyle counseling, and nutritional guidance for patients and staff. General Manager of the Presbyterian Hospital Agogo, Reverend Ezekiel Amadu Daribi, says the new installments reinforce the hospital's commitment to provide quality and standardized healthcare services.
This is the only secondary facility in the whole of this area. And therefore, in as much as we have dreams of becoming a tertiary facility, we think it is also appropriate that we continue to expand the services so that our teaming clients will have a better health service delivery.
My colleague Clinton Yabua joins me now. Clinton reported that patients are excited that they are spared a long drive. But what does this really mean for them? This newly furbished computerized tomography scan facility means to healthcare delivery at the hospital. Clinton, you have to unmute.
Yeah. Yes, sweetie. Yes, sweetie. So, the Presbyterian Hospital Agogo is a 93-year-old facility. And so for 9 decades, the tradition has been that patients, they receive over 10,000 patients every month. These patients requiring diagnosis are taken to physical examination. That is what we call the typical clinical diagnosis, where they are engaged physically, take their blood tests and everything. It's apart from the fact that they spend so much time doing all of these, when it gets to a time or when it gets to the point that patient's condition is so critical that they need to refer the patient or the patient require complex diagnosis, they have to refer the patient to other facilities, and most likely to be in Kumasi and Accra. The Konfadotchi is already a choked area, but they had no choice but to refer patients there. What this CT scan, the arrival of this CT scan mean is that now patients are spared of the long hours that they have to spend undergoing diagnostic treatment. Aside from that, referral would also reduce at the hospital. Patients are no more going to be referred to other facilities. And then the most important part is the efficiency and the accuracy that the machine will come with. The patient will not be engaged physically. It will all be done in a complex imaging system where patients would be accessed and be recommended treatment. That is one bright aspect of this whole thing. Patients will be assessed with a machine and also be recommended treatment. And that is what set it different from the typical and the traditional way that the hospital has been taking people through.
Thank you so much, Clinton Yeboah, bringing us the report on the new scan facility at Agogo. Now, let me...